So anyway, here we go on an intermittent hormone therapy question. It says, if I go on intermittent hormone therapy, would I ever consider supplementing testosterone during the off therapy time? And for some people, they think testosterone is an anathema for prostate cancer patients. But if you think about it, when we stop Lupron, we're liberating the testicles to make testosterone.
Yep.
And if men's tired, old testicles can't make testosterone and they want to do intermittent therapy, why can't we give them some testosterone, a cream or a shot or something like that, as long as we monitor them closely? And then, of course, with intermittent therapy, the PSA will start to rise up. And at a certain point, you have to cut it off. But I personally do support the use of testosterone for men on intermittent therapy that don't recover their own testosterone.
You know, it's interesting because I think when you're talking about intermittent therapy and waiting for testosterone to come back, there should be that discussion before it all happens. Don't you have a discussion with patients? In other words, your age, right? Your weight. I think people forget that heavier men tend to carry lower levels of testosterone, and the recovery can be extremely difficult.
Yep.
If you go to some of the bariatric or weight loss surgery data, people are always surprised that when men lose weight, they can see their testosterone go up 100, 200, 300 points.
Yep.
So that discussion, do you have that discussion with patients up front? Like, look, these are the factors that will bring your testosterone back to where it was, and these are the ones that won't.
We do have that discussion. And of course, diet is so integral. But I'd say one of the interesting discussions I have is that when discussing intermittent therapy, many people think it sounds so dangerous. And they're so frightened of their PSA rising. The studies validating the safety of intermittent therapy are amongst the best ever performed. It's really not in doubt at all. But there's a strong connection, an emotional connection to a rising PSA. And for some men, they would rather endure living without testosterone than face the frightening prospect of having their PSA rise, even for a short period. So that's usually what the discussion centers on is it worth the emotional wear and tear to confront a rising PSA, even though they feel better? They have it's easier to keep your weight off, your energy's better, your sex drive may return. There's so many good things that happen. Blood sugars are easier to control. So there's always that discussion, that push-pull. Are patients willing to confront the anxiety of dealing with a rising PSA, even though we know that it is safe?
And I think you touched upon a good point that we don't consider often in prostate cancer. You know, in anywhere else in medicine where you have numbers that people know. So, for example, like a blood sugar number, a cholesterol, when it comes down, people feel good. Right? It's tied to an emotion. It's not just an objective outcome. The emotion changes. When the PSA drops, whether or not you know what's going to happen 10 years from now, people will always tell you, I just feel better. Oh, that's a relief. My stress has dropped. So
absolutely. Yeah. So there's two sides to this intermittent game. Technically, by the numbers, it's safe and people do feel better with better testosterone. But I'll tell you, they don't always feel better if their PSA is rising.
Very interesting.